Every day is different as a veterinarian. Some good, some calmer than others, some dramatic, and even sad at times. Every patient that goes home with their family or whose suffering I can help is another reminder of why I do what I do. I am DocBott.
Last time on DocBott. DocBott treated a really sick puppy for the highly contagious parvo disease, spent time with his pets Sven, Titus, and the rest of the herd, and a little lady gave hopes of puppy news, only to find out that a trip outside would have had a different kind of delivery.
Malloy's mom brought Malloy in last week for kennel cough, who turned out to have severe pneumonia. Malloy's sister caught the cold and is now at the clinic for treatment.
I just thought it was allergies again. Like I said, she's been gone for a week in Washington. We just got her yesterday and she's sneezing, and at night she had a really hard time last night. Just doing that all night. She has the pneumonia. No discharge. She's eating. Her energy's fine. She's drinking water. The only thing is the sneezing and the coughing. She's acting normal, not acting sick. So I don't know what she did.
Start those antibiotics today and hopefully be on top of it.
I think she did. She definitely got as bad as he did.
Malloy's sister is lucky. Her kennel cough has not developed into pneumonia. Early detection is key in keeping pets healthy, especially in multi-pet families.
And everybody thinks she's a boy. No, I think she's a boy.
That's kennel cough all the way. Well, appetite and energy are okay. Let's just start some antibiotics and.
Okay.
Miranda sets the board with the day's scheduled appointments.
A good medical team comprises all of the staff to treat our animal friends. There are no small roles in a busy medical environment.
Pets can sometimes take on the temperament of the people around them, reacting to unusual interaction either positively or negatively.
Chester was brought in with concerns by his owner that he may have another bout of pancreatitis.
Well,
So what else sounds like?
yeah, I don't know what's going on with him. He's had pancreatitis before, and we were camping last week, and he got it eating a lot of grass. So I think, and then I caught him eating grass again this weekend. And I don't know, I didn't notice him starting to get sick until Tuesday night, and he came home Monday night. But I mean, he had in the middle of the night, he had to keep going outside, keep waking us up. Last night, same thing, he was whining a lot. It seems like he can't drink enough water, a lot of diarrhea. So something's going on with him.
Yeah. Okay, Chester. See if we can make you mad.
No, it won't pick much. So, and I don't pick him up, he'll bite me if I pick him up.
Okay, can you put a muzzle on him, do you think?
Vets are professionals at avoiding the occasional nip and may use temporary muzzles during the exam for safety.
So he'll even bite you if you try to pick him up, huh?
Yeah.
Chester, you naughty boy.
Yeah, he is.
Hey, partner.
Woo!
A little excited. See some cataracts. Pretty bad teeth, Chester. sure might get it someday. I have two. Did you know I have two shells?
You have two snow?
And teacups, yep, little tiny ones.
Oh.
So, one's 4.5 pounds, one's 3.5 pounds.
Oh, I love
They've got personalities of a Great Dane. They're pretty big. Testing for diabetes is prudent, as diabetes can affect behavior, temperament, and cause other health-related illnesses. All right, Chester. So hang tight for 6 about 12 minutes to get the results. So we're just running right now. You're not in a hurry, are you?
Oh, I can wait. Oh, we want to leave this on. What am I doing? Leave this on.
All right, Chester, we'll wait just a minute and get you some results. Heather here to pick up?
Yes. Okay. He's already started
So we're going to look at Little Bit now. Little Bit was attacked by another dog, and a very large section of skin was pulled off of the back on Little Bit. One of the biggest wounds I've ever seen, and compared to Little Bit's body, Little Bit's a Chihuahua, a large Chihuahua, and the entire back saddle portion, the entire dorsal lumbar area, actually clear up basically from the shoulder blades back to the pelvis, is missing skin. And it goes clear down on the side. We've had to go in and debride and remove some of the dead skin.
Little Bit was brought in by her human mom after one of the family pack got too aggressive and degloved Little Bit's skin.
There's no way to suture it close. There's just no way to do it. So you're stuck with either putting skin grafts down or what we call second intention healing. And so with Little Bit, we're relying on second intention healing. And so we're changing this bandage frequently, and that's what we're going to go do right now is remove the bandage, just look and make sure everything's progressing the way we want it. This is just going to take months, so for this poor dog to get better. We are seeing progress, so I'm very optimistic that poor Little Bit's got one heck of a lesion. Let's look at it right now. Wow, that is a pretty bandage right there. That's about the prettiest bandage I've ever seen.
She is
Little Bit. So that's working that wrap around the front, isn't it?
the tape was starting to hurt her on the front and the back, so we...
The other dog is a family member, has been checked for distemper, and was kept in the family, as dogs will be dogs sometimes, and the pack sets the pecking order.
Lots of bones, but she keeps trying to get to this side where that infection was, so I don't want that. Oh yeah, it's safety pinned. Because the little clips, I feel like they could poke her.
Sure.
And there's one more right here.
Wait a little bit.
I think it's looking really good, so fingers crossed. Even with that, she keeps trying.
Trying to mess with it?
Yeah, she keeps getting this side down just a little bit. So.
You can see what's going on. Let me grab my nice bandage.
Okay.
Here they are. All right, Little Bit. This is kind of deja vu for you. We're just talking about how big this is. This is one of the biggest.
The back is looking so much smaller. It's insane.
You putting that Red Wonder on? Is it
Of course, yes. Every time.
Dr. Davis, who built Mountain West Animal Hospital, developed a product called Red Wonder. And it's an ointment that we put on these lesions. Oh my heavens. So
is that a good or bad?
Excellent. So a little bit, this looks pretty crazy, but this is healing very, very, very quickly. We do have a little black line right here. We might have to go in and remove a little bit more skin, but that is still.
The bandage she had it on before was blue, and I think a lot of that might have been from that.
This is really nice, healthy. This is granulation tissue, this bed of pink. That is exactly how we want it. So we are progressing. It couldn't be better. So that's wonderful. So this is just slowly going to close in. It's probably going to take 3 or 4 more weeks. This is one of the more impressive wounds that you'll ever see on a dog. Okay, so this is the new gauze right here. This is called hydrogel. So we're gonna
Is
try
that what this coloring, this coloring, is that from the gel?
It might be.
Because it wasn't there before the
It's-
procedure,
yeah,
so. Okay.
I think it's just what we call fascia.
Okay.
So we're gonna just put this right against here.
Oh, perfect.
And then we'll put a telephone pad over the top of this too.
It's okay. You're okay.
I have a whole bag of supplies more for you there, but
Okay.
This little dog is lucky to be alive. Every few weeks, Little Bit comes in to check the progress of his healing. He's very tolerant of the treatment and is back to his happy, normal self. So these are huge Stelfa pads right here, basically the backside of a Band-Aid, non-adherent pad that we just place right over the top. And before we had to use 1.5 of those, and now one is almost perfectly fitting. We've really progressed. That is very impressive. A little bit. I was worried about you. I think you're going to be able to leave them now.
She's stubborn. And she's not taking the second pain pill anymore either. Like, I gave it to her once in like 5 days.
She's not even responding right now with this, so it's
Yeah.
just really progressed. It's
When
so-
we
so
do the,
tender. Remember how tender it was for her?
And that's when we do the Red Wonder. There's one tiny spot that she kind of just twitches a little bit, but other than that, she just shakes and takes it.
One bandage change in 3 days, and then we'll come in like 6 days next Thursday.
Okay,
That looks good.
perfect. I think I actually have an appointment on the 8th, so perfect. Oh, I have a clean one. And these I just washed back
Super. Where are those pins at?
right here. I just slid them out of the way.
Oh, you're really gonna be styling here now.
And then I just... Okay, gotta stand up there.
She's such a sweetheart. Most dogs wouldn't tolerate a lesion like this and having to go through these bandage changes. She's been a trooper. It's always neat to see that. She's got a unique little personality. I poke myself here a little bit. Almost guaranteed to happen every day.
My daughter says this is her skirt and her shirt. That's it.
There's a bag of goodies for you.
Yay. Perfect. Thank you so much.
Thanks for going.
Here's one more.
We'll see you next week.
See ya.
See you a little bit.
Sweet girl.
Unfortunately, Little Bit passed away from age-related causes shortly after the filming of this episode. That's when we opened, but we didn't need it. It's okay for a minute.
Autumn's owners waited a while to bring her in, hoping the sneezing was temporary. DocBott has other ideas on why Autumn is sneezing.
Stickers and had some, the foxtail stickers, and then she had to stop sneezing.
Since?
So, yeah. She gets
When did that happen?
Sneezing attacks. Probably Saturday or right now.
Foxtails are a plant with a hooked end that burrows itself into any tissue and continues to dig, causing massive infections, even death.
This is going to be very challenging. I don't have anything really small enough to stick up the nose, so I'm going to be able to get a little otoscope and maybe just look a little bit inside. But this is more consistent with kennel cough than having something up the nose, though. I don't know if there was more coughing than sneezing.
Just sneezing.
Just Foxtails are serious business. Always, always, always remove any grass or burrs from your pet. Check their paws regularly and do not let them eat dried grass on hikes. Pet shoes are a great idea if you hike a lot to protect their paws.
Far up as I can see, I cannot see anything in either side. So, a couple of options. We could sedate, and I can maybe get in a little bit deeper to look with that. I can send you to a specialist that actually would have the cameras that can go up a dog's nose.
Think it'll come out naturally eventually, or?
No, they usually don't. So if there's something in there, it would be better to definitely get it out. Yeah. You know, of course, something like this is best to immediately do it. You know, if it's a foxtail, it's like an arrow. It's a one-way. It doesn't come back. It's just going to go in. And so if this happened, you know, 5 or 6 days ago, then it could really be up in there deep. It might just be sneezing. There might not be anything up there. If that's the case, then a nose spray would help with that pretty significantly. But I don't know. What are your thoughts?
I don't know.
I think I could go up a little
Her
deeper.
sneezing
But
has gotten less, but I don't know. I mean, I don't know.
Frustrations with owners waiting too long to have a pet seen are common among veterinarians.
like going further and we shake our heads, and it will cause major bleeding. So.
Let me talk to my wife and
Okay.
see what she wants to do.
Pet insurance is an inexpensive option for pet owners and usually covers emergencies, vaccinations, and yearly visits. Putting aside as little as $20 a month can help with pet emergencies. Early treatment is always less costly in the long run and saves suffering.
So cases like this can be quite difficult. They come in for reported sneezing. There is no sneezing whatsoever here at the clinic. That's kind of how it works. Pets miraculously heal themselves on the way through the door. I took my otoscope, which is made to look inside the ear canal of dogs, and looked in as deep as I could inside the nasal passages on each side, and I can't see anything in there. There's a little bit of clear mucus. So I gave him two options. Number one, I could sedate and actually go in a little bit deeper with my otoscope. Problem is that the nasal cavity is very sensitive and very vascular, and so if we were to shake our head when I had that jammed up the nostril, then we would bleed significantly, and so we definitely want to be sedate if I did any more exploration. Or we could send them to a specialist that actually is going to have a little, it's called rhinoscopy. It's a little camera scope that they can put up the nose and actually see if there's anything in there and retrieve it. Just my gut feeling is I don't think that there's anything in there, but it's hard to say. You never do know without sticking the camera up exactly if there is or not.
So we just ran blood work from Chester, and ironically, it's pretty darn normal. We do have a mild alkaline phosphatase elevation. I'm not too concerned about that. Everything else looks really, really good. It is not pancreatitis. It is not liver disease, and it's not kidney disease. It's not diabetes. Those are the main things that you see in schnauzers. So I think we just had an upset stomach. Or we got into something we weren't supposed to while up in the mountains. But I think we can get him healed up really, really quick. Hey, Chester. Well, looks good. It's not pancreatitis,
Oh, good.
which is good.
Yeah.
There is one little elevation. It's called alkaline phosphatase. This enzyme is produced in a lot of different areas in the body. It's produced when you have really bad tartar on the teeth, which is where I think it's coming from.
Sounds
We'll
good.
get these shots and see if we can get Chester feeling better. And Chester has a history of having masses that we've had to remove on his chest. So Chester has a chest mass. That's an easy way to remember. But Chester came in today. They had been up camping, and Chester has been lethargic and having really bad diarrhea. And in the past, Chester has had a bout with pancreatitis, which is an infection in the pancreas. It can be very difficult and very dangerous for dogs. Luckily today, when we ran blood work, everything checked out pretty normal for Chester, and so our actual diagnosis was gastroenteritis. Comes from indiscriminate eating Chester ate something that he probably wasn't supposed to get into up in the mountains. Could have been deer poop or a leaf or anything. Basically anything that changes the pH in the gut can cause signs like this. Now Chester is very nippy, and even when his owner tries to pick him up, he'll try to bite her. And we don't know what this behavior is from. Chester's a little bit older. Chester has cataracts. Chester has a large tumor on the right side up in his armpit, and he has a huge tumor on his left side that expands. his entire thorax. And so it might be actually a pain response that when you touch those tumors that he nips at you because it's uncomfortable for you to pick him up. And really they're so big that there's no way to pick him up without touching one of them. And so I assume that that's in part what's causing the aggression. But in Chester's case, I'm going to attribute it more to having tumors and being a little bit painful and cranky as opposed to being aggressive.
Emergencies are part of the day at Mountain West Animal Hospital. Blue, the young sheepdog, was brought in by his concerned owners fearing a broken leg by the alpha dog in the home. One of DocBott's key pieces of diagnosing equipment is a state-of-the-art X-ray machine, allowing him to diagnose and treat many injuries quickly.
Blue just had a sprain, probably from being a puppy and roughhousing with the bigger dogs in the house. He'll be just fine with some pain medication and some rest.
So some anti-inflammatories, and we should.
Do you think wrapping that would help?